This interactive program is designed to raise public awareness of venous thromboembolism. All of the content discussed during this presentation comes from peer-reviewed medical research published by members of Thrombosis Canada. Hi there, my name is Menika Pai, and I'm a thrombosis physician at McMaster University in Hamilton, Ontario, Canada. I'm also a member of Thrombosis Canada, a non-profit network of Canadian doctors, nurses, pharmacists, allied health professionals, and medical researchers across the country. Our members are world leaders in the diagnosis, prevention, and treatment of blood clots, and we care for thousands of patients with venous thromboembolism, also known as VTE, across Canada. We want Canadians to understand the problem of VTE and help us solve it so we can save lives. Venous thromboembolism, also known as VTE, includes deep vein thrombosis, known as DVT, and pulmonary embolism, known as PE. It's a major problem in this country. VTE affects about 5% of Canadians in their lifetime. Every year, 200,000 Canadians are diagnosed with VTE, and about a quarter of them are actually hospitalized for this problem. So what is venous thromboembolism? Venous thromboembolism, or VTE, refers to blood clots in the venous circulation. These are the blood vessels that return blood to the heart so it can be replenished with oxygen. If a blood clot develops in the venous circulation, then blood starts to back up. Areas upstream from the clot can become swollen and painful as blood without oxygen starts to pool, while areas downstream from the clot become starved of oxygen and can actually die off. Deep vein thrombosis, or DVT, occurs when a blood clot forms in the deep veins of the pelvis, leg, or arm. Symptoms of DVT include pain, swelling, redness, heaviness, or warmth in the affected area. If a deep vein thrombosis breaks off and travels to the lung, it can result in a much more serious condition called a pulmonary embolism, or PE. PEs occur when a fragment of a blood clot, called an embolus, breaks off, travels through the blood vessels, and gets stuck in the lung. Symptoms of PE include shortness of breath, a sharp chest pain that gets worse when you take a deep breath, lightheadedness, a racing heart, or coughing up blood. Pulmonary embolism can be life-threatening. Very often, when our patients get a VTE, we can't explain why. We call these types of VTE idiopathic clots. But we do know that there are certain factors that can increase your risk of getting a blood clot. For example, your risk of a VTE can go up if you're older, if you have a serious illness like cancer, or if you're hospitalized or confined to bed. Remember that patients in hospital, because they are often coping with other serious illnesses, are at a higher risk of developing clots. Patients who have certain kinds of surgery are sitting ducks for blood clots. We know that 60% of patients who have total hip replacement surgery and don't get appropriate preventative therapy develop DVT. Your risk of VTE goes up if you're pregnant, if you've just had a baby, or if you're taking estrogen-containing medications like certain birth control pills. VTE is also a major women's health issue. Women are at higher risk than men of developing clots because of their increased estrogen levels. A woman's VTE risk increases 6-fold when she is pregnant. In fact, PE is the third leading cause of maternal death associated with childbirth in industrialized countries. Even though VTE is a major problem in this country, there are solutions. Thrombosis Canada believes that the cornerstone of solving the problem of VTE is prevention, and we can now offer Canadians good preventative therapies. We can use compression devices to keep blood flowing through the legs. We can use injections or pills to keep blood clots from forming. And if caught early, VTE is also treatable. We now have a variety of options to treat VTE in Canada, including surgical therapies, injectable medications, and oral medications. If you or someone you love develops a blood clot, it's important to work with your healthcare provider to figure out the solution that works best for you.